Okay, so we'll go ahead and get started. I want to introduce our speakers for session 2, communicating with vulnerable populations about pandemic-related health risks. So we are fortunate to have with us today Samantha Grinrock Murray, who is Senior Public Relations Specialist for the University of Florida's Institute of Food and Agricultural Sciences. We also have Megan Kimmel McPherson, Associate Director of Communications for the University of Florida Clinical and Translational Science Institute. Ashley McLeod-Morin, Communications Coordinator for the UF-IFAS Center for Public Issues Education in Agriculture and Natural Resources. And Matthew Surrency, former Mayor of Hawthorne, Florida. And my name is Lisa Lundy. I'm a faculty member at the University of Florida and part of the center. So the speakers in this session will share lessons learned about approaching vaccine hesitancy through community-based collaborations. Speakers will cover challenges with communicating science to rural and minority populations, how to establish trust in said communication, as well as successful approaches and strategies. And there's a couple of key takeaways for this session. First, the role that trust plays in health risk communication and behavior change. Vaccine listening session results from local leaders, and the advantages of building collaborative partnership networks across sectors. So we're going to start with a question for the panel. If you could just walk us through the process of communicating health risk communication messages. And that's really, we kind of talked about Megan and Sam, if you guys want to kick us off with that, but really if anybody has anything they want to contribute to that, that would be wonderful.
Sure. Sam, do you want to introduce yourself, and I'll introduce myself, or like what our roles are, and then we'll go through what we were going to present.
Yeah, so I'm in the Central Communications Office for UF-IFAS, which includes the teaching, research, and extension arms of our land-grant system. And so at the start of the pandemic, got involved in talking to counterparts over at UF Health, which is our health sciences system and hospital. And so that's how I got involved in doing a lot of communications around COVID-19 and then later on vaccination.
Yeah, so those of us on the call have actually been working together across our different institutions and groups this whole time. Well, maybe not the entire time, but a lot of the pandemic time, because we've been working so collaboratively across UF and across the community. My role, I'm the Associate Director for Communications at the UF CTSI. However, prior to taking on this job, I've been working for UF Health Communications and the College of Medicine. I still technically work for UF Health Communications, and once a week I work as the Public Information Officer for our health system for UF Health. So been entrenched in pandemic and vaccine communications since March of last year. So Sam and I wanted to address, communicating health risk communication messages, which, this started out as a pandemic in March, a year and a half ago, and we haven't really stopped. It's been an ongoing process of communicating to our audiences about this crisis and the risks that are COVID-19. So we have a large group, not just the four of us on this call, but lots of people, upwards of 40 people sometimes are on a phone call, and we still meet weekly, if not twice a week. Mayor Surrency, or former Mayor Surrency, is also part of a community organization group that we have running once or twice a week as well to talk about vaccine access and vaccine hesitancy. So we've been working very collaboratively. I would say as communications professionals, Sam, Ashley, and I, and the rest of us who land on these phone calls several times a week, we are operating from the basis of crisis communications and risk communications, which is, part of public relations. So where we operate in our regular day jobs. We didn't have any idea that this would last quite as long as it did, but here we are still on a daily basis, understanding what the message is and who we need to talk to and who our audience is, and changing that as frequently as needed. the best practice from, we're practitioners, we're not the researchers doing this, but from the practitioner's perspective, the best practice here is to be prepared for any situation, emergency, crisis, risk, and understand how it can impact our institution, our hospitals, our business, if that's where we're working. I would say in any case, we started this off treating it like a hurricane, like we would with any public health issue. We have a hurricane coming. We had a hurricane of a pandemic coming. But now it's become a long-term issue. So like I mentioned, it's an ongoing and changing beast on a daily basis. So in crisis communications, the basis is planning well, knowing all possible scenarios or as many scenarios as possible, and being timely in our response to what we say and what we do. And, knowing that as a hospital system and as the University of Florida, we are the experts. So sharing our expertise and having timely messages that are helpful to our community. And in communicating specifically, we focus on action items, what people can do right now, and how they can help themselves, as well as speaking truths and not myths. So something that we as a communications group have to remind ourselves frequently, and that we try to guide others on, is don't repeat the myths that you might hear when it comes to the pandemic or vaccines, but reinforce the truths. So maybe Sam could give me a good example. One's not coming to mind right now what I'm trying to say, but when somebody says the vaccine are going to make you magnetic, we don't reinforce that and we don't say it. We say the vaccines are safe and they've been tested. All right.
Exactly. Yes. Because in the information ecosystem that is the internet, the more you feed it those myths, the more it gets kind of amplified. So that was an interesting thing to observe. Certainly, the fact that we're having a pandemic in the age of social media and internet and all of that definitely creates another layer of complication. And I guess one thing that I wanted to talk about with respect to this question was, that this is, as Megan mentioned, very much an extended crisis. But with that, you kind of have, it's sort of like this roller coaster. You kind of go up and then you go back down. And so you have these periods where there is, a lot changing really quickly. And that can be hard as the communicator because you're trying to position your experts in your institution as like this solid source of consistent information. And it's really difficult when the information keeps changing to maintain that. So for instance, in addition to the vaccine becoming available, the changing recommendations for masks definitely threw a wrench in things. We had our very hardworking creative services folks, creating all of these, graphic assets and stuff, communicating certain things. And then a few weeks later, those would become, out of date because things had changed already. So again, I think one way to kind of ride those waves is something that Megan already mentioned, which is just to stay in constant contact with people. She wasn't joking when she said, at one point we were meeting 3 times a week. And then of course, emailing and all of that in between. Because, as these things bubble up, we need to, be ready to communicate about it to the communities we work with and also our key stakeholders. So for me, working in IFAS, I was always thinking about, well, how does this impact the industries that we work with a lot? How does this impact agriculture? How does this impact our 4-H programs, different things like that? How does this impact the way that our county extension offices are going to be operating? So kind of acting as a point of view that's looking maybe even beyond a central campus or beyond the health system was kind of what I was keeping an eye on. And to give you all an example of how we sort of operate with vaccine hesitancy, which is the topic we're talking about today, first we identify, like, what does this issue really mean, right? What is it that we want to place in the minds of the people that we are talking to? And so we decide, well, the vaccine is a way to protect ourselves from severe illness. Some people are unsure about getting it, or don't plan to get it. That is a situation in which we find ourselves in. So what we want is, again, to have people know the vaccine is safe, it's effective, go get it, influence others to do the same. And, while that is a very simple message, we bring to bear all sorts of different communications tools to make that happen. So we're working with the news media. We create advertisements. There's print materials that people can use. Certainly social media is an excellent tool and very important one. Also doing more face-to-face or more, touch point type of communications with webinars, events, town halls, and also leveraging the influence of folks that we ended up calling vaccine champions. So these are people who have influence in their community, who work with, say, a vulnerable population or a population that's under-vaccinated, and can spread a positive message in a way that we just wouldn't be able to. So those are some of the strategies and tools that we're still currently using. Again, we're still kind of in the thick of this. That's what we've been doing.
And we're not stopping, every
Right.
day, like Sam said, every day something has changed. The guidance has changed. There's a new rumor, there's a new concern. So we have to reevaluate very often and figure out how we can address the current issue. So I think the next part we wanted to mention was understanding how and if your organization plays a part in communicating about this public health emergency. So, where do you lie? Where do your people lie in what's being said and what's being talked about in the news, or talked about in your office space, or talked about in your institution? How can your experts, or how can your expertise lend to that? So, following the trends in news to understand what you should be communicating, like we said, we have to reevaluate frequently. Do you have experts? Do you participate in the conversation? Are you a trusted source in your community? Maybe you're not an expert in this area, but you are a trusted source in your community, like former Mayor Sternsey. He was the mayor of Hawthorne. So lots of people in the city of Hawthorne knew him. So know you. So he's a great source and a great partner to work on this with us, so that we can deliver the message to people in Hawthorne, that might not be on our social channels or logging into our webinars because they don't have internet. So who's delivering the message, and who maintains good relationships with the people that you're trying to reach? Who do they trust, really, is the question. We have, and I think Mayor Sternsey will probably talk about this, but we have a lot of, pastors and other community members, commissioners, et cetera, that are part of our group that talks about how do we communicate to different people. And then as far as communications practitioners go, Sam and I and the rest of our very large group, we do look to the research and the science to understand how to communicate and how to communicate well. And, we keep track of guidance from Kaiser Family Foundation, from the dashboard, from CDC Crisis and Risk Communications, plus our own, like Pi Center and College of Journalism and Communications, which has done their own research and put out their own guides and resources on communicating about the pandemic and vaccines. So, there are a lot of very helpful and insightful resources for us to draw on. And we're taking it out and doing our best with those that we're trying to reach and, get vaccinated. Currently, we will be, I think Sam and I will be working on a more rural campaign in the panhandle of Florida. So we have to kind of reevaluate who we're talking to and what we're talking about, but use all the tools that we've been building over this time. One thing I wanted to point out from what Sam said was, we had to scrap some things. I've learned from working as the hospital PIO and changing visitation signage, as well as our coronavirus vaccine materials, don't throw anything away. It will always change and you might need it. So whatever you've created, make sure you have a nice resource and keep track of everything. Okay, with that, I think that we probably did our best to answer that question, and we can probably go on to the next.
Yeah, that was fantastic. And you all alluded so well to the changing dynamics and how messages have changed and the things that you want to focus and the audiences that you maybe were trying to reach have changed. And so, former Mayor Cernsey, I would love to hear from your perspective as a community leader, how those challenges have shifted for you throughout the pandemic, from prevention to vaccination and everything in between, your perspective on that.
Well, thank you, Lisa, and I appreciate y'all having me here today. And it's an honor to join Megan, Sam, and Ashley as panelists, and hopefully share some what's worked for us and what sometimes we've learned from hasn't worked sometimes as well, because that's part of it, is you just try and do things to get the message out, and some things work, and you have to learn from those other ones that don't necessarily are as effective. And I apologize ahead of time, as I just got kicked off not too long ago. As we mentioned about broadband, and that's one of the communication challenges also out here in the rural communities, is making sure we have good connectivity. And so a lot of our communication has been done actually just face to face. Of course, social distancing with a mask and trying to make all the precautions we can. But I think the only thing that has changed throughout the pandemic has been the message itself. The way we go about it and the tools that we used has been real similar. We've adapted a little bit, but we've always used that trusted relationship. For instance, many people that know me know I'm very uneducated on health itself, like the medical part of it. My wife always makes fun of me because she's in X-ray at the VA, and I tell her some things, and she's like, "No, that's not even what that's called." And it's like, y'all just make up words anyway, so it doesn't matter. But I think what my role was just, and still is just to get the foot in the door, so to speak, to knock on the door, have a face that people can identify with, not necessarily a face people like, but a face that people can identify with and that they've built trust over the years. Same thing with partners that we have on our collaborative, is just to have that foot in the door. And then even one time we went around knocking on doors and brought medical experts with us from UF, and they actually, and we even had some students that were there, some medical students there, helping us go around and survey who's actually had the vaccine, who wants to get the vaccine. This is whenever it was first available to the most people that were at-risk populations, to make sure that they had it before we open it up to other people. And so going around and then saying, here's this medical expert that can actually answer your questions for any hesitancy that you have about it, or any, misconceptions that you may have, that you just can't get it, or just finding out what the barriers are as far as transportation, and making sure we, eliminate as much as we can the barriers and the obstacles that they had. So the message may have changed, being preventative, as taking precautions, social distancing, staying home, not doing extra activities, not having house parties, playing bridge or whatever else, or going to church and separating a little bit, to where now we're still doing some of that, but we're also encouraging people for the vaccine itself, and to go ahead and, make sure people, like Megan said, it's not magnetic, it's not all this other stuff, but just eliminating that part and reinforcing what the good parts of it is, and showing the actual data. And Alachua County does a great job with that as well, especially with the hospitalizations at SCCAHS, is just showing the facts and communicating that, saying, you don't have to take my word for it, but this is what is happening in the ER. And unfortunately, now it's made it easier to convey that message because more people have been affected by it. And the more people get affected by it, whether it's them themselves or someone else they know, the more educated they get, because it's not what, the guy on Facebook has been telling them. It's, it's actual affecting them now. And now they're doing anything they can to prevent it for anybody else to have to go through that same experience.
I really appreciate what you said about how the message may change, but what you're learning about building trust and the methods and the audiences, how those things are staying the same. So that's encouraging that we, even though we maybe are having to make some changes to the messaging, that we are learning some lessons that we can keep applying. Ashley, I know you have kind of a different perspective on that from some of the work the PI Center's done and the research. I wonder if you can share some of the things that you've learned throughout this process.
Absolutely. Thank you, Dr. Lindy. So like Dr. Lindy mentioned, I'm the communications coordinator for the Center for Public Issues Education. So I really have the opportunity to take all the great research that the PI Center and a lot of our partner programs does here, and then actually able to apply that in creating materials that can address these really wicked problems, as Dr. Gutter alluded to earlier, like COVID-19 and like vaccine hesitancy, to really try to move the needle forward among these partnerships. And so based on a lot of the research that the PI Center has done over the last year and a half, and then a lot of the experiences that I've seen from the communication side of stuff, is people were really experiencing information fatigue. Like we've heard about already today, there were obviously a lot of changing messages that were happening. First it was how to prevent COVID-19. Now, what do you do if you do get infected? Should I get the vaccine? All of these different questions that people are dealing with. And at some point, especially people that don't have the coping mechanisms for this type of information, they just kind of turn away new information. They said, you know what, there's too much. I go on Facebook, I turn on the news, there's always something about this, and I just have to turn off any new information. And so that's one thing I think that we're really trying to focus on now, is how to address that information fatigue. How can we kind of get past that? And I'll talk a little bit more about this later, but one thing that we can do to address that is to be able to test messages. Of course, guidance is going to change, and the message to that guidance is going to change. But if we know what's going to be the most effective message right out the gate, I think that's going to be really helpful in eliminating the overload of information that people are feeling now. One thing that former Mayor Matt just mentioned that I wanted to also hit on was this idea of health literacy, especially when we're working with underserved populations and rural populations. There's really the question of health literacy, and do people understand all of these really long words? I'll sit on some of these webinars and they'll talk about things related to COVID or vaccines, and it's like, I have no idea what you're even talking about at this point now. And so that can be really challenging. And so how can we really boil down that information for people? Especially we talk about, we see right now people doing their own research about these things. Well, let me Google about the vaccine, or let me Google about COVID. But even that can be dangerous in itself. But a lot of these people also don't have the same resources to be able to accurately get some of this information. A lot of these populations don't have the opportunity to have one-on-one conversations with their doctor. Maybe they're uninsured, or they just don't have the opportunity to easily get to the doctor. My parents live in a rural part of North Florida, and just to get to their doctor, it's over an hour drive, and so that's not a trip that they're making regularly, of course. There's also the challenges about, especially early on in the stage of the COVID-19 vaccine, rural and underserved populations were having challenges getting a vaccine appointment. My grandmother wanted to be one of the first ones to sign up for a vaccine. And she's someone who has never used the internet. And so, my parents are trying to help her get an appointment, and it's confusing even for them. I know I was talking to my mom, and she's setting her alarm for 4 a.m. in the morning to get up and try to get in online quick enough to make a vaccine appointment. And we heard a lot about those challenges early on. Of course, it's a lot easier now. I think you can pretty much just walk up and get a vaccine. But how we can think about those things moving forward in future situations like this, and how can we go ahead and alleviate some of those problems, I think is going to be really important. Another thing, especially when we're thinking about these underserved populations, is the idea of local news as a gatekeeper. We heard a lot about, particularly in rural communities where the social networks looked a lot different than they do in urban communities, was that they kind of felt like, oh, the local newspaper is bringing in maybe its own bias in this information. We heard some specific examples about maybe there were new guidances, or maybe vaccines were available in that community, but it only received a small part of maybe an inside of a paper in their local newspaper, and it wasn't, the headline. And so things like that about access to information really becomes a challenge at that point. And so how can we help address that in these different communities so that everyone at least has access to effective and accurate information? Another thing about social networks being different in these communities that we really have to think about is the way champions work differently. Sam talked about how, champions have been a huge element of communication, especially when we're talking about the vaccine. But those champions look a lot different based on different communities. And so really being able to effectively find the opinion leaders in these different communities, whether that's underserved populations or rural populations. Of course, we've talked about, Mayor Matt Strincy being a prime example in a rural community where, it might be a celebrity endorsement in a more urban community that's more effective. But people really want to know, hey, I trust my neighbor. I want to know what my neighbor's experience has been, and being able to share that story on a really personal level can make a lot more progress in some of these communities. So yeah, I think that we've learned a lot, and we're going to continue putting these lessons learned, I think, into practice as we move forward out of this pandemic, but then also how we can think about these lessons learned in future public health challenges, where we really see the intersection of agriculture in these rural communities and public health, of course.
Thank you so much. And we're going to kind of tag on to what you ended it with there, and sort of the lessons learned, and hear from Matt and Sam. And we've alluded to this a little bit, but just to sort of highlight some of the most successful approaches that you have seen to increasing vaccine uptake among vulnerable populations as we think about health equity today. What would you share on that note?
Thank you, Dr. Lundy. Yeah, I think we've learned quite a bit of how to do better and also what's worked, because I think especially among a lot of the hesitancy people, of course, myself included, I was one of those that I'm just, deathly afraid of needles. So that's my biggest phobia, was needles. And we actually made a little flyer the communications team put together, and that helped out as well with a fan that we passed around the community and passed to the church. And I'm not always big on having my face on stuff, but it's a way for us to communicate with people that they could recognize with, and then also personalized it. And so we passed those out, and I told people they could either use them as fans or they could use them as whichever they choose to do. And that kind of lightened the mood, and then also was a constant reminder for people to be able to see that even myself, that I'm out here promoting this, that I was hesitant because just being afraid of needles itself. But I think also anytime we get any kind of diagnosis or we start feeling ill, outside of COVID, outside of anything that's going on in the world today, if it's just a stomach ache or a headache or just something different that we haven't felt before, our first reaction is to go to Google, and we Google Doc everything. And, by the time you're done researching, you're just about on your pulse to see if you're still alive. And I think that's what a lot of people are doing. And they try and do it because they want to self-diagnose. But just like in previous cases, after they do all that, they still go to their trusted doctor that they've trusted for 20, 30, 40 years. and they have that relationship. And so with people that are hesitant, that are doing all this Google searching, instead of me arguing with them on their porch about whether they should or should not get it done, I've just encouraged them to go talk with the person that they've trusted for the last 20, 30, 40 years to help make health decisions and to make the best decision for them and their family that way. And that's kind of a roundabout way, because like I've seen other people before, that they've actually put, I guess that they wanted a note to clear them from having to wear a mask. But at the same time, they realize that no physician is going to sign that note to give them the clarity or the clearance to be able to not wear that, because they know it won't be healthy. So I think that was, some of the challenges that we faced was the Google Doc stuff. The other thing was, Megan mentioned it earlier, is pastors, especially in our rural communities like Hawthorne. We're very diverse, but most all, like 99% of us go to church, and the other 1% be at church but have other obligations like work or whatever else. And so we trust our pastors, our faith leaders, but that's also a good way to congregate and get the message out. So we use those partnerships to a lot of people at one time, and to help us get through those organizations. And not all of them were faith-based. We had other organizations too that we worked through, but getting them to get a consistent message out, getting them to help bring the vaccine to those areas, to make it easier, to break down those barriers, to say, hey, you don't have to find transportation to Gainesville or wherever, to the hospital, to the health department. We'll actually bring it to you. So you're not having to go on. We had the same thing with people trying to go on using technology to schedule appointments. And it just got to be where it was so difficult for them that we, just made access easier. I know I got mine done at the Ben Hill Griffin Stadium at the Champions Club, because, to me, it was symbolic. One, being a huge Gator fan, working with the Gator Radio Network and all that. But two, being in the Champions Club. We consider ourselves healthcare champions in our community. And to be at the Champions Club, I think that symbolized us being champions, getting the vaccine, to go up there and do that. And now, as we talked about previously on the previous question about the change in the message, but the same tools, through this committee, we found out that there's still more of a need beyond COVID that we're going to need to address. And I know this is a COVID committee, but on this, for any other issues that we have, the methods can still work. And just the change to healthcare in general, to access, to bringing those resources to the community, to disseminating the information, to getting the experts out there, and to just get that shoe in the door with community leaders, I think won't change. So just continuing to get people that you trust involved, and then bringing in the experts to answer the specific questions and to get them to those resources.
Thanks so much, Mayor Hesitancy. Just to echo some of the things that you were saying, I think this is me speaking as a communicator. Sometimes it's hard because you feel like, okay, I've got all these messages, but I'm not the person who is out there in the community, knocking on people's doors. So what is my role, and how can I sort of, empower those people who have influence? And a kind of recent example of this that I think worked really well was Megan mentioned that we're sort of moving into doing more in rural communities elsewhere in Florida. And we had a doctor who's up in Jackson County, which is, a very, very rural area with very low vaccine uptake. And there was a doctor there who, he really wanted to help. He was like, I want to get out there. I want to be advocating for this, but I'm not really sure how. His name is Dr. Gay. And so we just gave him some, communications resources. We gave him, kind of a tip sheet on, here's how to talk about vaccination with people who are unsure about it. Here's a PowerPoint that you can, give when, at your local Rotary Club or Lions Club or something like that. Here are just some things. And I think, sometimes as communicators, we underestimate the power of those sorts of tools, and he came back to us and he said, wow, it's been so hard to not become exasperated when I see the numbers in the hospital, and they're all people who are unvaccinated, and it's really hard to continue to want to talk about this. You feel like, oh, I just want to give up. But he said that the tools we gave him were really helpful and really changed his perspective. And that personally for me was like, oh, we did good. And so I think it's things like that where, it's that one person who has been working in their community for 30 years, and they want to help, but they're just not quite sure. And so we as the experts at the university, that's how we can make a difference, is just by empowering those folks.
Well, I think that transitions us well into the last question we were going to talk about, and then we'll see if we can answer some questions from our participants. And this is for Ashley and Megan, of thinking about, as we look to the future, and other health messages that we may be communicating about to diverse audiences for public health crises or interventions. What are some of the communication strategies that we can be using going forward?
Yeah, I think this is a great question for us to think about. Again, hopefully there's an end in sight with the pandemic, but I think that there's going to be some reoccurring challenges, whether that's with vaccine hesitancy or just disease communication in general, that I think that we can better prepare for now in the future based on what we have learned over the last year and a half. And so one thing I would say in very general terms is to take this opportunity to really look at your organization's risk or crisis communication plan, or maybe develop one if you don't have one to review, and really reflect on what you've learned with your specific audience. So you likely, as an administrator or a scientist or researcher, you have a niche audience that you communicate with, whether you know it or not. And so think about what you've learned communicating with that specific audience throughout the pandemic, and how you can better prepare for future risk communication events. I think will be really important and help us be better prepared in the future. Again, really focusing your communication efforts on education rather than promotion. I think that one of the big challenges that we've seen in vaccine hesitancy was that it often came across in a very promotional or commercial way, but instead kind of using Mayor Sorensi's approach and really educating people on, well, this is what I think, this is what the science says, but talk to your doctor about it in a way that really educates your audience in a way, rather than promoting something. Again, really being able to test messages before they're utilized when time allows. We haven't had a lot of time to do that over the last year and a half, but I think that this can really help us address this idea of message fatigue when we have so many different messages really about the same thing. How can we really tease that out to be most effective? And then, of course, focusing on grassroots communication. That's going to be particularly important when we think about these underserved populations. And one of the best things about grassroots communication from a planning perspective is to really not wait until a pandemic hits to be able to develop those relationships that are necessary for grassroots communications. And so, we've talked a lot about this collaborative team that IFAS and UF Health has. But I think that one of the best things I think that came out of COVID was that partnership really got stronger, especially from a communication perspective over the pandemic. That I think that we could have been better prepared in some ways if that relationship had been stronger even before the pandemic started. And then finally, I'll say before I turn it over to Megan, is really thinking about how we can provide up-to-date information to these rural healthcare providers, especially, the example that Sam just mentioned, how we can think about that from a disease perspective that goes beyond COVID, that a lot of times these rural healthcare providers don't get information as quickly as maybe Shands might, that's right here connected with UF Health. And so thinking about how we can really include them a little bit more in the communication process a little bit more, I think is going to help us effectively get information to those rural audiences that are coming to their doctor as a trusted source for information.
The two things that I wanted to add were, coming off of what Ashley said, cultivating trust with our audience and getting to know your audience and what they need. So, as far as the message itself, engaging your audience in message formation. So something that we do here in the Clinical and Translational Science Institute is engage community members in talking about research studies or talking about the science and the research and getting their perspective on things before rolling out with perhaps a study. So I think that same concept can be applied to what we've talked about here, in that we want to understand how our community members might interpret something, or what the best channel might be for them, or what the best terminology might be to, talk to a specific population. So every community is very different from another, rural versus city versus Republican versus Democrat. So, in one of the communities we've talked to, they had a very personal situation in a small town in which a young person died after getting the vaccine. Now, whether it was related to getting the vaccine, we don't know, but the perception was that that person died because of the vaccine. So they have a big hurdle to overcome to get those folks vaccinated, because they aren't necessarily on board after one of their young people died. Do you need to consider different languages? We've considered Spanish, Creole, other languages in the communications that we create and that we try to get out into our community. Speaking on diversity, there are people in all different cultures. You can't just include one type of person in what you're communicating. You need to consider who is in your audience. Do people look different? Do people talk different? Are people, within different faiths? So my suggestion is, don't keep your communication singular, but consider everyone in your audience and who you might not be thinking of. One thing, just as an example, in our, these groups that we've been talking about, meeting at UF on campus to talk about communications around pandemic and vaccines, they span the whole campus, and then we create materials that address the needs for students or for faculty and staff. And what we've created, we've thought, okay, we have a lot of different people here in this global community at UF. So we have our materials that we've made for signage across campus has included people in wheelchairs, people with different hairstyles, people with different skin colors, people with headdresses, people with all kinds of different cultural icons and different abilities and disabilities. So, we just keep that in the top of our mind that, we're not all the same. And let's see. So for the future, to communicate better, I think that what we've learned, one of our biggest lessons is that collaboration is key, not just within our large university system, which Sam and I have never collaborated before this year, but now we collaborate all the time, including as well as Ashley. So now in our own institution, we collaborate much more and share information. But in our community, collaboration has been key to keep up with what's happening on the east side of town, what's happening on the west side of town, what's happening in the rural communities, and understanding what people need and what people are saying. So, collaborating has really helped with where we will go from here and moving forward to hopefully not another pandemic, but maybe another public health issue, and understanding where we need to be and what we need to do.
Thank you. Just some great lessons that you all have shared. I want to try to answer a couple of the questions that participants have submitted. And Ashley, you talked during your comments earlier about the information fatigue that people have been experiencing. And so to speak to Glenn Israel's question here, how do you continue to keep people engaged? And anyone who wants to answer this can, when people maybe are tired of hearing about COVID messaging, how do you continue to keep them engaged on a regular basis?
I can chime in here. And I read your question, and I wasn't sure whether you were asking whether we should say like keep up to date, or whether our message should be like make sure you look for the latest information. But my suggestion for our communications and our messages would be, give them the action to do and encourage them to get vaccinated. And then by keeping on top of what the latest issue is, then we can create new messages that aren't the same repetitive messages. For example, there was a new study that we put out a week or two ago about breastfeeding mothers and breast milk, relaying antibodies to babies. So that was a very big topic. We created material for that. So just understanding what people are talking about right now so that your message does not have to be the same and repetitive.
To add to that, I think a lot of the fatigue just comes from not wanting to encounter that like constant negativity. I think that, that's often what makes people look away, and that's a totally normal reaction. And I think that we've gotten a lot more mileage out of content and messages that are more positive overall. So Megan's example just now, okay, it's a story about COVID, but it's a very positive thing that we've learned about it, and is, represents something positive that somebody can do or tell to other people. So I think those things don't get old for people. And I think that the unfortunate thing is that early on in the pandemic, it was just bad news after bad news. But now I think, we have more opportunities to tell those more feel good things.
Yeah. Also, just piggybacking on that is, especially when you think back to the very beginning, is just being consistent, being open and being honest about the whole thing is the key. Because especially starting out, whenever we were all learning about this, scientists included, we're all learning about the COVID, all are learning how it's going to affect us and when it's actually, how we're going to treat it, everything, to now to when we have a vaccine and we're trying to find out if, younger people can have it and other situations. But I think the key is to always stay in communication, be consistent, be open, and tell people, make sure they knew that this is something relatively new as far as COVID-19 is new, but not COVID itself. So is just being consistent with that and letting people know that as new information comes out, we're going to have it available here, but we're also going to bring it to you as well. And so just consistently doing that in an open, transparent way.
And I'd like to tack on from that to kind of lead into the next set of questions that kind of alluded to general science literacy, research literacy. And I think one of the big things, and also the idea of echo chambers, is being really transparent right away. And I think that this is really challenging from a researcher or a scientific perspective. But I think there was a lot of confusion about the vaccine because of the vaccine because of the speed that it took to get available. That we should be thankful that we live in a country that we did have access to the vaccine so quickly. But then there were also people that had a lot of questions about, well, is it safe? Is it effective? Because it was so quickly. But then whenever you kind of peek behind the curtain, and there's been research on these types of vaccines for decades, and that we've really been preparing for this type of moment, and that's why it could happen so quickly. But I think that there's so many people that don't really understand the scientific process, kind of like in your question you alluded to. And so I think that one of the biggest things in addressing problems like this is going to be effective science communication, and effective science communication that really transcends one pandemic or one public health crisis, but how we can really, going back to establishing trust between these group members, especially between scientists and researchers and the general public. And I think that that's really promoting these relationships between these two groups and providing methods of two-way communication before we get to a crisis situation, right? And so having those communication channels in place before we get to a COVID-19 situation. And I think that is going to create work on both sides. Of course, building science and health literacy in community members. And I think that there's a number of great programs that are really working toward that, but then also really promoting effective science communication from a scientist perspective, and knowing how to build relationships with the public, and how to have these conversations with the public about the scientific process, I think is going to really help move the needle forward in behavior changes as well.
Real quick, just to answer the last question, is a lot of, especially the scientific part of it, we get lost in the big words, especially out here in the rural areas, and myself included, but is to talk at the level of whoever we're talking to our audience. And I use the perfect analogy. I love those, just because, especially whenever people are trying to understand the vaccine. Of course, out here, I told people, I said, just think of it like, your truck. I said, you have the vehicle the whole time. We have the vaccines the whole time, the vehicle that we use. But in certain situations, we're going to change a piece of it. And that piece of it, like on your vehicle, may be just your tires. So in an off-road situation, you're going to use it for this. You're going to use street tires for this. Same thing with the vaccines. They'll make little tweaks to be able to use it for COVID-19 or whatever it may be in the future, as there's other stuff that mRNA is being used for. But I think that's the key, is just relating it, to your audience. Thank you.
Well, thank you, everyone. Just want to say a special thank you to our presenters on this panel. You all did a wonderful job and shared so much great information with us. We are going to wrap up this session, and you'll start the next session at 10 after 12, right over on the left tab where the sessions are. So thank you so much.
Thank you.